Pectus excavatum, also known as funnel chest, is a non-genetic defect of the chest wall marked by overgrowth of the costal cartilages, a sunken appearance in the anterior chest, and a restricted sternum. It is the most common congenital chest deformity. The goal of the surgery is to reconstruct the chest to restore normal respiratory function and body image, with appearance being the most common reason. The Nuss procedure is used in which a metal bar is placed to lift the chest wall. This bar can be left in place for 2 years or longer until growth is complete. Rome's tumor is a nephroblastoma that is the most common primary renal malignancy in children. Surgical en-bloc resection is performed when possible. The kidney, ureter, and adrenal gland is removed as a whole. The neural tube is an embryonic structure that gives rise to the central nervous system, spinal cord, and brain. Normally, the embryonic spinal cord develops from a flat area which rolls into a tubal structure about 28 days after conception. A neural tube defect occurs when the tube fails to close completely. The most common are called spinal bifida, encephaly, and encephalocele. Spina bifida is the most common myelomeningocele, in which an exposed portion of the spinal cord and nerves are contained within a membranous sac. This sac may rupture at birth. Patients with this defect often have latex allergy. And encephaly is the absence of the cranial vault and is incompatible with life. Encephalocele is an anomaly in which the meninges, CSF, cerebral spinal fluid, and sometimes brain tissue are contained within a herniated sac. A craniotomy for craniostenosis is performed to correct the premature closure of an infant's cranial suture lines. Syndactyly is a congenital deformity of the hand or foot where the fingers or toes are fused or webbed. The goal of the surgery is to separate the fingers or toes to restore function and normal growth. The surgeon will also use a zigzag incision to separate the digits, creating triangular skin flaps. Polydactyly is a congenital deformity of being born with too many fingers or too many toes. The fifth finger, the pinky finger, is the most common one that is duplicated.